Hi everybody, my name is Dafna Lender. I'm the training director at the Theraplay Institute, and I'm here to tell you about my workshop, which I am presenting at the 5th International Theraplay Conference, July 14th and 15th in downtown Chicago. The workshop is going to be about combining Theraplay with dyadic developmental psychotherapy, which is a method of therapy working with kids who have trauma and attachment issues, and it's developed by Daniel Hughes. DDP, dyadic developmental psychotherapy, is a little bit more cognitively focused because in DDP you do talk about the child's behavior and try to connect it with earlier traumatic experiences in order to help the child integrate their history and to be able to understand themselves and develop a coherent narrative. But it has a lot of similarities with Theraplay in that it is very much focused on the nonverbal attunement, on reading the child's mind, on getting to that deeper affective experience, and really on acceptance of the child. And so because there's so much in common between Theraplay and EDP, that's why it's so easy to go back and forth between the two modalities in one therapy session. And it's a particularly good tool to have in your toolbox when the children that you're seeing come in and the parents will say, well, this week my boy said, I hate you, why did you adopt me, just so you could be mean to me, or I want to die and come back as a butterfly, when they're saying bizarre things, they're saying painful things, and the parents don't know how to deal with it. And the child is also obviously feeling a great deal of pain and doesn't know how to make sense of it. So clearly you have to talk about those things in a therapy session. So what I'll do is I'll integrate DDP right in the middle of a Theraplay session. I might start with a regular Theraplay session, and then I will choose a time where I will just launch into something that happened during the week, some altercation or some negative experiences. Talk about it in a really curious and empathic and accepting fashion, and help the parent to resonate with the child's feelings. And very quickly we can get to the core feelings of loneliness, of shame, of rejection, etc. And then after maybe 15 or 20 minutes, when the child perhaps has had enough, that's when I'll go right back to the Theraplay games and continue with the Theraplay session from where I left off. So it has there's a real nice balance between the two, more of the talking and then the playing, and the just a real good combination for very much integrating both the attachment aspect of therapy and also really addressing the trauma. So I think you'll enjoy it a lot. I hope that you come. I will be showing 3 real cases of working with traumatized kids as well as traumatized parents. So, if you want to know more about it, look on www.theraplay.org. See you at the conference.